Greetings, SAISD family members, and welcome back to the beginning of the 2021 school year. This part of the presentation that you're experiencing today is called SAISD Safe Start, because that's certainly what we intend for you and what we want for you so that you feel comfortable returning, to work and starting with the new challenges that the school year will begin. So the purpose in general is to help make sure that you understand all the planning that has gone into the return to work or the period for you to report back to work, and to help you understand just how we're going to continue to manage the challenges associated with COVID-19. We understand that you're anxious about that you've been living through this now for several months. Hasn't necessarily become any easier. And we truly understand that, but we want you to feel that there will be processes in place to help ease the transition, and that you know that we're aware of those concerns and that we're working diligently to address those concerns so that you can ease back into the workplace as smoothly and as confidently as possible. So the topics that I'll cover include reporting process for employees who are affected or impacted by COVID-19, leave and non-leave options, and the return to work plan and expectations for employees. I'm sharing with you a visual that kind of captures the process that we're using to manage COVID-19 issues as they develop and as we experience them with employees. There will be a companion document that's created for students by Student Health Services so that the same process steps generally will be followed. But rather than getting into this detail, this chart will be posted and made available to all employees. We're going to chunk the information on the chart so that I can spend a little bit of time clarifying some of the key points. So the top of the chart addresses different categories that employees may fall into, and those that are colored in orange are significant because they relate to individuals who either have had close contact with someone who's tested positive, an employee who's symptomatic and is being tested, or an employee who has already tested positive for COVID-19. In any and all of those cases, we want employees to immediately report their circumstance to the employee's immediate supervisor and the human resources. For campus employees, obviously it's always going to be reported up to the principal. Even for custodians and child nutrition staff who are assigned to campuses, they should have dual reporting to both campus principal and to the division head or supervisor. But in addition to that, all of these must be immediately and timely reported to human resources following processes that we will make clear to you. That fourth box, the white box, applies to employees who are asymptomatic, but they choose to get tested because testing has become more available, not always as easily accessible as we would like, but it is more available than it was months ago. So many employees just decide out of an abundance of caution or curiosity to test. And when they do that, because they don't have symptoms and they are negative in terms of the results or the outcome, no other action is required. I want to mention a couple of groups that will be involved directly in this process. And the first is going to be, once someone reports because they fall into one of those three orange boxes, then employee benefits is going to notify me, and we'll also notify Gloria Davis, who's our Director for Health Services. We're Tier 1. We have some responsibilities to manage the process, and I'll explain that in greater detail in a minute. But we also have a COVID support team that includes the two of us, in addition to Patty Salzman, who's our Chief Academic Officer, and Leslie Price in communications, just to make sure that they are aware of what's happening, whether it's with students or it's with employees. And that team makes any recommendations to the superintendent if there was a need for any work site closures to happen as a result of a positive test. And let me just give you a very short example of what that could look like. During the month of June, our athletics department managed a great strength and conditioning program for anywhere from 800 to 1,000 student athletes a day during the month of June. And they were structured in pods or small groups so that certain athletes reported to the same pod every day, along with one or two specific coaches. If we experienced any positive test result for either a student athlete or a coach, then it's that pod with student athletes and coaches that would potentially be quarantined, as opposed to the entire athletic program if they didn't have regular close contact with those athletes. So when those types of things happen, and hopefully those will be anywhere from minimal to non-existent, but if they do happen, then this COVID support team would communicate directly with the superintendent so that we could take whatever proactive measures we needed to ensure everyone's safety. The Tier 1 team, on the other hand, will directly manage the situation. We'll make the decisions about whether to send employees or any other employees home to self-quarantine. We use contact tracing based on CDC guidelines to include a 2-day look-back period. We will make sure that operations is notified so that they can provide a deep cleaning service for the work sites that are affected or involved. We'll communicate directly with affected employees if employees test positive, and then communicate or notify all other employees who need to be notified and supervisors before any clearance for returning to work. Tier 2, in terms of notification, obviously includes the Office of the Superintendent, the appropriate cabinet member, Leslie Price in Communications. They need to know they're not directly managing the situation, but certainly we're always in consultation with the superintendent and cabinet and Ms. Price for any communication with media. Tier 3, individuals include, again, the immediate supervisor. If I am notified that someone on a campus has tested positive or is testing and symptomatic, I'm communicating directly with the immediate supervisor, or someone else from our office is doing that, or the appropriate department or division head, campus principal if that's applicable. These individuals are key to this process because they assist us with contact tracing, and I'll elaborate shortly on that definition. But these individuals in this tier don't have delegated authority to close programs or campus or to send employees home. Those decisions will be made in communication with human resources, nor will individuals in this category notify or inform employees about diagnoses and test results. Again, we just need to handle those matters through student health services if it involves a student, or through human resources and employee benefits if it involves an employee. Just want you to be aware of the typical symptoms associated with COVID-19. You've probably seen these in doctors' offices before and even posted outside businesses from time to time. Some of the more common symptoms include the fever, the cough, but this list has grown over time. This is a list that's been created by the Centers for Disease Control, and certainly we'll continue to update and monitor. There are going to be some symptoms that are more typical with children than with adults. We have experts on each campus, nurses, members of the health services staff who can help, with any assessment with respect to student issues. But these are the symptoms that are the most common and that are posted by the Centers for Disease Control. So contact tracing has its own definition, and it essentially involves identifying people who have an infectious disease, so these are the cases, and people with whom they have come into contact, so these are the contacts, in an effort to make sure that we're working with them to interrupt the disease spread. When we were first exposed to this pandemic, to COVID-19, it was mostly through spread through travel, but certainly that mushroomed quickly into community spread. So it's important for us to know who employees or individuals, students, have had contact with if those employees test positive or students test positive, so that we can identify those contacts and do what we need to try to interrupt the continued spread of the disease. And that will include asking people with COVID-19 to isolate and for their contacts to quarantine at home during a specified period of time. To be exposed to COVID-19, you need to have close contact with a person who has the virus. There's a very specific definition for close contact, again, that's been created by the CDC. It includes living in the same household as someone who's tested positive, or caring for a sick person with the virus, or being within 6 feet of a sick person with the virus for at least 15 continuous minutes without the use of a face covering. Persons are considered to be most infectious 2 days prior to symptoms, so we use a 2-day look-back period. Sick period is defined specifically for the person who's already contracted COVID-19. Their symptoms are manageable at home. Hopefully, we realize that some individuals end up being hospitalized, but if they're in a sick period, we're saying that it's because they're managing their symptoms at home and they're gradually resolving those symptoms. And if the employee doesn't have a fever for the last 24 hours of the 10-day sick day period without using fever-reducing medications during the last 24 hours, then the employee may return to work after that. But that will be coordinated and communicated with and through employee benefits. A quarantine period applies to a person who has had close contact exposure to COVID-19 and to an individual with COVID-19, whether it's outside the workplace, in the family, or in the workplace. And those individuals, once we identify them through contact tracing, must remain isolated to see if symptoms develop over a 14-day period. All contact tracing will be managed and directed by Human Resources and Student Health Services. Certainly, if a student is involved, it will be managed exclusively by Student Health Services, but communicated with Human Resources so that we can also conduct contact tracing involving employees. But if it involves employees, Human Resources takes the lead, but is in close communication and coordination with Student Health Services. So let's look at a few different employee scenarios. The first one will involve an employee who tests positive. Second one, an employee's household member tests positive. The third, an employee reports close contact exposure. And the fourth, the employee reports secondhand exposure. In scenario one, if the employee tests positive, whether the employee is symptomatic or asymptomatic, the employee will be in a 10-day sick period. The employee will continue in that sick period, and HR will determine, close contacts for quarantining purposes. The employee may return to work after 10 days if symptoms have improved and the last 24 hours are fever-free without the need for fever-reducing medication. In scenario two, an employee reports a household member having tested positive. Whether the employee is symptomatic or asymptomatic, if it's a household member, then we presume that the employee is positive. If the employee does test positive, the employee will continue in the sick period and HR will determine any close contacts in the workplace for self-quarantining. If the employee tests negative, the employee may return before 14 days if medically cleared. And again, employee benefits will be in close communication with the employee to make sure that they're cleared to return. In scenario three, an employee reports close contact exposure. So this may have occurred outside the workplace, could have occurred within the workplace, but again, you presume that the employee is positive if they were not able to maintain social distancing and wear a face mask or face covering during that time of contact for any 15 minutes or longer period of sustained contact. If the employee tests positive, then again, the employee continues in the sick period. HR determines any close contacts for quarantining purposes. If the employee tests negative, the employee may return to work. And then there are occasions when employees have been exposed outside the workplace, potentially even inside the workplace, but exposed to someone with COVID, but on a secondhand basis. In this case, and let me just give you an example. If an employee attended a function or a gathering and the employee's cousin was there, the cousin's not positive, but the cousin's boyfriend tested positive, the employee has not, by definition, been exposed based on close contact. In that case, we would encourage the employee to continue to self-monitor for symptoms, but that employee can continue to work. And if those circumstances change because the cousin ends up testing positive, then we will have to reevaluate the situation at that time. The process that I just defined for contact tracing and close contact is managed not only in compliance with HIPAA and FERPA requirements, but also in communication with Metro Health and certainly based on CDC guidelines. With respect to HIPAA and FERPA, I make a footnote about those two matters because we will certainly protect the privacy of students and employees who may test positive. We're not going to identify them by name to the larger public, to the general public. We'll be in communication with anyone through contact tracing that may have had close contact, and we'll speak with them confidentially about the circumstances, but we're not going to publicize any information related to employees or students because there won't be that need to know that level of detail. This is also very fluid, so other updates and revisions will be made as appropriate. It was just this week that the CDC posted some new guidelines, so we've made some adjustments, and always if there are questions, we're going to ask you to consult Human Resources. So I'm sharing here a flyer that was created after Congress passed the Families First Coronavirus Response Act back in the spring. It went into effect April 1st, and it expires on December 31st of 2020. And I share this with you because it covers some leave options that are available to employees who are impacted by COVID-19. It specifies that under certain circumstances related to COVID-19, that employees may be eligible for up to 80 hours of paid leave under the Emergency Paid Sick Leave Act. In this case, employees would be placed on this leave and not have to draw from their own personal leave to cover any period of time that they're out, up to 80 hours, which for some is the equivalent of 10 days. For those who work fewer than 8 hours a day, it would be perhaps a little bit more than that. There's some max rates that employees would earn under the circumstances, and I'll elaborate on that in just a few minutes. So part of the flyer outlines the reasons that employees would qualify for leave related to COVID-19. So if we just refer to it as COVID leave, for instance, in numbers 1, 2, and 3, if an employee is subject, or an individual, but an employee in this context, is subject to some kind of quarantine that's ordered through federal, state, or local guidelines and had to be in isolation, they would be eligible for the leave. Or if they've been advised by a healthcare provider to self-quarantine because of close contact, they would be eligible for the leave. Or if they're experiencing symptoms themselves and are seeking a medical diagnosis, they would be eligible for the leave. And again, it's up to 80 hours. If, on the other hand, the individual is in number 4, caring for an individual who is subject to numbers 1 and 2, they're a healthcare provider for a person who's tested positive for COVID-19 or some other isolation order related to COVID-19, then they would also be eligible for the leave. In these cases, there would be, we would have to discuss with the employee how that would impact their pay, because there are some limits on how much you would get paid depending on whether or not you're the individual who has to be isolated or whether it's because you're caring for someone else. But that information can be shared with you through employee benefits as necessary. And then the fifth reason is if someone is caring for his or her child because the school for that child or the place of care for that child is closed. That would be another reason someone would be eligible for a form of leave, but again, it's going to be at a reduced level of pay. So after the emergency paid sick leave has been exhausted, employees can consult with employee benefits to discuss other additional leave options that may be available to the employee, to include perhaps some options that might not cause us to have to use the employee's leave, personal leave. For instance, if an employee ends up having to be out for a second time or a third time, once perhaps because they were sick, another time months later because they were in close contact, or a third time because a family member, a household member was ill, then the employee would use the EPSLA up to 80 hours the first time. And if they exhausted all of that 80 hours, then we would have to talk to the employee about other leave options. But if we're requiring the employee to isolate, we're going to explore offering other options that will not include using the employee's own leave, just to make sure that the employee is safe and not feeling more stressed because they either don't have leave to use or they're going to exhaust all of their leave. But we will communicate specifically and individually with employees who find themselves in those situations. So another form of leave that was made available by Congress is what's called the Emergency Family Medical Leave Expansion Act, and it expands to go beyond the typical reasons that employees request and take family medical leave, and it allows partial paid leave for child care issues for employees if they've at least been employed by the district for 30 days prior to taking this form of leave or requesting this form of leave. And this applies when the employee is not able to physically report to work or telework following the standards that the district establishes for telework due to child care. And essentially it's because the child's school or place of care is closed or unavailable for COVID-19 reasons. Again, in this case, the employee can take partial paid leave up to 12 work weeks. It's not at the full rate of pay, but again, we'll share that in greater detail as those situations arise. I've covered some of this already, but the second bullet reflects the fact that partial pay during this period of leave for child care is maxed at 2/3 of the daily rate, up to $200 a day. This will expire. This is available to the employee for up to 12 weeks. This will expire at the end of this calendar year. It runs concurrently with traditional family medical leave. Remember, it's an expansion of the Family Medical Leave Act. And again, if there are questions about this, those questions should be directed to employee benefits. So there's some additional considerations that we've certainly been spending a lot of time considering, thinking about, discussing, and under limited circumstances, and always as approved by Human Resources, some employee categories may have the opportunity to work remotely for a limited period of time, which would negate the need for someone to take leave. Now, I say for a limited period of time because all employees by a date certain will essentially be expected to report to work. But we will consider, especially for teachers during the first week, whatever flexibility we can consider until the numbers of students who have reported during that first 8 weeks period would actually warrant and require that employees are working and teaching in the classrooms as opposed to teaching remotely. So if employees believe they have a need to telework because they have a medical condition that may prevent them from physically reporting, they should contact Human Resources to begin the conversation. Medical documentation in those cases may be required, and for more information, we are asking you to contact Employee Benefits so that they can provide some guidance and direction. Even with this, there will be kind of a timestamp. It'll be a short-term approval, if it is approval, given whatever flexibility we feel we have at any particular point of time, making sure that we're there to meet the needs of the students that are actually attending school. So there are 3 questions that are most frequently asked questions from employees. The first one is, what do I do if I have underlying health conditions and I feel I need to work remotely? Well, if you feel that's the case, we do want you to reach out to Employee Benefits. We do want you to provide medical documentation. We will have some conversations with you about options. We will consider being flexible during the first 8 weeks, as long as the campus doesn't need you to report in person. So we're going to have to analyze each of those requests on a case-by-case basis, because it's going to be driven by the needs of the campus, the needs of the students that are being served, more broadly, the needs of departments. Again, we're willing to offer some flexibility during the first 8 weeks because our student numbers are going to be easier to manage. But that's going to be an individualized conversation and discussion that you'll need to have with the appropriate medical documentation with Employee Benefits. Second question, what if I have a household member who is immunocompromised? The response is going to be similar to the first one, in that we will offer flexibility as long as the needs don't demand in-person reporting during the first 8 weeks. Again, this is going to be short-term, because at a point, all employees are going to be expected to report. And what we're talking about right now is the option to work remotely versus the option to take a leave of absence. Certainly, any employee who has a health condition that would require them to take a leave of absence can apply for a leave of absence. Any employee who has a household member that requires their care for whatever reason, certainly can request a leave of absence under the Family Medical Leave Act. So that's different than working remotely. The remote work will be limited in terms of time, but we will be as flexible as we can be to try to ensure that employees feel comfortable without compromising our ability to make sure that we're taking the needs of the students that we serve and the others that we serve and support. The third question, what if I'm too nervous about physically reporting to work? Can I just work from home? Again, we understand the anxiety related to this. We truly appreciate the fact that there's some level of anxiety that everyone's experiencing. At some point, everyone's going to have to report to work. And we're not going to have continued opportunities or long-term opportunities for employees to report or to work remotely. So if someone really feels, I just can't do this just isn't the time for me to be able to manage the day-to-day demands of a job and balance that with my concerns for my health, for my family's health, I just can't do that right now under these circumstances. We understand that, we respect that, and we can have a different conversation with you about your plans and whether or not you feel you need to separate, from the school district until things are, different for you. At the end of the day, though, we're going to need everyone to report by a specific date. We'll offer the flexibility where we can for those first 2 questions. Those requests are going to have to be supported with medical documentation. But for the third one, we're not really going to be able to honor requests of this nature for remote work without having the medical documentation to support it, even for a short-term period. So our return to work plan has been created and developed with much discussion, tapping into different interest groups, different support groups, with three things in mind. First of all, it's a student-centered plan because it's going to be driven and will always be driven based on the needs of the students with respect to, do I have the properly certified teachers in front of me? And it's going to be driven by student numbers. How many students do we have on campus at any given time? You've already seen information presented to you about the phase-in plan. We've created a plan that gives us a chance to have numbers of teachers return in phase one who are going to be part of the lead team that will help us work through all the safety protocols, be trained on those safety protocols, and be prepared to give us good, insightful input and feedback about anything that needs to be tweaked or changed before phase two comes in. You already know that phase two would be required to report the week of August 31st. And then phase three, the last phase, would be required to report after Labor Day when we open it up for face-to-face instruction with students. So student numbers, student needs are first and foremost what we're considering, and safety is certainly what we're considering across categories. So we've been as employee sensitive as we can be by rolling this out in phases, by considering your questions, by adding the flexibility to allow some employees that have some medical issues personally or for household members to have a little bit more lead time, perhaps if we have the medical certification before they have to report. And we will always continue to be receptive to your questions or your suggestions because, again, we know how stressful and trying these times are. And we want you to feel healthy, we want you to feel safe, and that you can come back and, perform at the highest level possible and feel safe and secure in the meantime. And then certainly, last but not least, it's always going to be about the state of affairs. Again, this is fluid. We're constantly pivoting to respond to new directives, new demands, new requirements, and we'll continue to do so in consultation with Centers for Disease Control, Metro Health, our own internal communication stream, and anything else that's coming, from the state government, whether it's, through TEA or the governor's office, anything else, local, local administration, et cetera. So this has been developed in consideration of everything that's important about this, and certainly you and students are front and center in terms of what's important, and safety is going to continue to wrap around everything that we decide and everything that we do. So with that, I want to thank you for your attention to this. Again, we felt it important to get a consistent message out there for you, to make sure that you knew who you could turn to if you have questions, and most importantly, if you have needs. We appreciate all that you have done in the past and that you will do moving forward for the students and the staff that you serve and support. And above all, we want you to remain safe, and we thank you for, again, your commitment to SAISD. Have a good start.